Welcome, everybody. My name is Melissa Van Dyne, and I serve as the Executive Director at the Missouri Rural Health Association. And today we are here to discuss our Missouri Customized Caregiver Training and Relief Program. This funding is supported by the Department of Health and Senior Services, and it is a partnership between the Missouri Rural Health Association, the Alzheimer's Association of Greater Missouri Chapter, and the Memory Care Home Solutions. Just a little bit of information and data for you to kind of set the scene. The Alzheimer's disease is the most common cause of dementia, as it accounts for 60 to 80% of dementia cases. There are at least 100,000 citizens with Alzheimer's disease within the state of Missouri. This is estimated to increase to 130,000 by 2025. In 2019, the direct cost for care for those with Alzheimer's disease totaled an estimated $290 billion. In Missouri, there are an estimated 317,000 family caregivers for persons with Alzheimer's disease or other related dementias. There are twice as many caregivers of those with dementia when compared with caregivers of people without dementia, and those indicated substantial emotional, financial, and physical difficulties. The greatest risk factor is the increasing age, as the majority of people with Alzheimer's disease are 65 years or older. Alzheimer's is the sixth leading cause of death in the United States. So a little bit of history about this particular program. So the Department of Health and Senior Services Alzheimer's Service Program was actually initiated in 1987. With funding appropriated by the state of Missouri to assist persons with Alzheimer's disease or other related dementia and their families by providing respite and other related services to caregivers in order to postpone them having to go into an institution or other long-term care. The customized in-home caregiver training program was initiated in 2007. To provide personalized training that includes care consultations and in-home of the caregiver to reduce caregiver stress, improve communication, and make the home safer for the person diagnosed with Alzheimer's disease or other related dementias. Beginning in 2020, these two funding opportunities were combined into one to better serve all of Missourians. This will be called the Customized Caregiver Training and Relief Program. It is divided into two tracks. Track 1 focuses on caregiver training, and Track 2 focuses on caregiver relief. A person may only be enrolled in one track for the enrollment period at one time. And today we are going to do a high-level overview of each one of those tracks. So I would like to introduce Memory Care Home Solutions, who is going to discuss Track 1, which is the caregiver training. And Jill or Candace.
Thank you, Melissa. My name is Jill Sigliana, and I'm the Program Director at Memory Care Home Solutions and an occupational therapist by background. We are thrilled to take part in this statewide opportunity and appreciative to the Missouri Rural Health Association for helping to spread the word, to oversee and administer this program, and to make sure that as many families as possible who could benefit are connected with this help. So a little bit about what we do at Memory Care Home Solutions. We're a not-for-profit organization based in St. Louis, and thanks to this funding opportunity, can make our program available statewide. So the mission of our organization is to extend and improve time at home for people who are living with dementia in any form and for their family care partners. So we do this with a caregiver training intervention, which is Track 1 of this program. So the slide you see illustrates kind of our touch points with each family that we serve. And the program that Melissa described today covers the entire process that you see here, with the exception of occupational therapy visits. And I'll explain that in a bit more detail. So our program begins with a family meeting and training session. So what we know is that we family members would like to assume that dementia caregiving is common sense or intuitive or easy, because this is in most cases a person that we've known our entire lives. But the reality of dementia caregiving is that it's far from easy, and it's actually counterintuitive, and takes a lot of creativity and flexibility of thought to accomplish well and to reduce frustration and stress for everyone. So at our initial family meeting, we help everyone to get on the same page, to understand the changes that come along with dementia, and to learn some new skills and strategies to modify the home environment, or to simplify the daily activities and the daily routine, and also to teach family caregivers how to change the caregiving approach and communication to make the daily activities even easier. So that's our starting point. And every family who participates spends about 2 hours with one of our social workers. They get a packet of very helpful resources, including a guidebook, handouts, links to community resources. And then on steps 3 and 4 of this slide, we follow up with every family over the course of a year at scheduled checkpoints to see how the education and training is helpful and what additional needs there might be. And some of our families want to need more help to master some of these skills. It's not something that everybody needs, but some of our families do request more intensive help. And that's where we might schedule some additional visits with an occupational therapist. And those visits are typically covered through health insurance. And thanks to the great support by the state of Missouri, the initial training and the year-long follow-up are provided at no cost to participants. Next slide. So you may be wondering who can participate in this track of the program. And the eligibility guidelines are really very simple. What we need for people to participate is just someone who is living with suspected or diagnosed dementia. And unfortunately, dementia often goes undiagnosed, which is why we don't require an official diagnosis by a physician. So if there's a family where we suspect that somebody is experiencing memory loss, memory changes, that's good enough to meet criteria 1. And we also need an informal care partner. It doesn't necessarily have to be somebody who lives in the same home, but it's somebody who is involved in the day-to-day life of the person who's living with dementia. So if these 2 criteria are met, we have somebody with suspected or diagnosed dementia and an informal care partner in the form of a family member or friend who's willing to take part in the program, then this is an appropriate referral to our program. And I will pass it back to Melissa.
So Ben, Molina is from the Alzheimer's Association, and he is going to be talking to us about track 2, which is the caregiver relief portion of this program. Ben, I'll hand it over to you.
Thank you, Melissa. Hi, everyone. My name is Ben, and I serve as Client Services Manager for the Alzheimer's Association at the Greater Missouri chapter. And we are also very excited to work with Missouri Rural Health Association and Memory Care Home Solutions to deliver these great programs to families in need. So, as Melissa mentioned, Track 2 is the Caregiver Relief Program, which was previously known as the Respite Program, and is being delivered by the Alzheimer's Association. And I would like to introduce the Alzheimer's Association to those who may not be familiar with us. We are a nonprofit organization that provides services to individuals with memory loss, caregivers, healthcare professionals, and the public. Best part of this is that our programs are delivered free of charge. One common misconception is that we only serve individuals who have Alzheimer's, but we serve individuals with all forms of dementia. Even if you are suspecting that you have memory loss. And I would like to introduce some of our services that we provide. The main way that families got connected with our services is through our 24/7 helpline, where we have dementia experts around the clock to help families in need. You may call us if you are concerned about your memory and you would like to learn more information about the diagnostic process, or if you're a caregiver handling a challenging behavior at 3 in the morning and need help, give us a call. We also provide care consultations, which are individualized planning sessions with our care consultation team. During these care consultations, we learn more about your needs, what your concerns are, provide education, and help you get support and get you connected with services in the community. We also provide education programs, support groups, and early stage social engagement programs. Currently, all of our programs are being delivered virtually, which means you can access all of our services from the comfort of your homes. And you can stay up to date with our programming by visiting alz.org/MOHelp. Next. And so let's talk a little bit more about the Caregiver Relief Program. The Caregiver Relief Program was designed for caregivers who are needing a break or who are feeling the financial burden of the services that they may be paying for or products that they may be purchasing. Through this program, we are able to reimburse caregivers up to $700 for respite services and care products. Some of the services that we are able to reimburse caregivers for are in-home care services, whether you're hiring through an agency or hiring someone privately, like a neighbor or a church member. If you're interested in using adult daycare services or are already using these services, we are also able to reimburse you for those. We are also able to reimburse caregivers for nutritional supplements and continence products. Some items that were not mentioned in this slide that are also commonly reimbursed are dementia-specific medication like Aricept or Namenda, or home safety products and medical equipment like door alarms or grab bars. To be eligible for this program, a caregiver must be caring for someone with a diagnosed dementia at home. So this means that the person with the diagnosed dementia must be living with the primary caregiver at home. There is no formal application required. All that we ask is that you give us a call to schedule a care consultation. And this is an opportunity for us to learn more about what's going on in your life. What are your unmet needs? What are you struggling with? So we can provide that education and help you get connected with those resources and that support. And at the end of this conversation, you come home with an action plan, which are specific action steps that you can take to address that unmet need. If you are a caregiver or know someone who would benefit from the program, please call our 24/7 helpline number, which is 800-272-3900. Or if you're a healthcare professional and you would like to make a referral to the Alzheimer's Association, you can do it online at alz.org/Greater Missouri/referral. And there is a link to an online form that's HIPAA compliant. Thank you.
All right, thank you, Ben. Thank you, Jill, for kind of giving us a high overview of each one of those tracks. So we do have some upcoming additional information opportunities or other webinars. So on March 24th, Memory Care Home Solutions will be back, and they will be discussing with us in more detail about track 1 and some other opportunities that Memory Care Home Solutions can provide. And then on March 31st, the Alzheimer's Association of the Greater Missouri chapter will be going over track 2 in a little bit more detail, and also kind of discussing with us some other opportunities that they may have to help us care for our loved ones with Alzheimer's or dementia as well. Both of these will start again at 11 o'clock. So they will be, and they will both be recorded. So these will be put on the Missouri Rural Health Association website. We will share it with social media and get it out on our newsletter, so you can share it with those of individuals who you might find will find this information helpful as well. So we look forward to seeing everybody on March 24th and March 31st as well. There's also some contact information. So if you have other questions before the other webinars, please feel free to reach out to any of us at the Missouri Rural Health Association. We also have contacts at Memory Care Home Solutions for you and the Alzheimer's Association of the Greater Missouri chapter as well. And as always, we ask that you feel free to ask us any questions. Feel free to reach out to us with those questions, and we will get you sent to the right place. Again, these webinars will be recorded and are going to be placed on the websites and social media for easy dispersal for our participants as well. And we appreciate you all taking your time with us today. And we look forward to seeing you next week for Memory Care Home Solutions and Track 1 overview. Thank you so much.